This is Urban Health Today, and I'm speaking with Dr. Cory Rice, a functional medicine and anti-aging medicine practitioner. He's here to talk about life after patients stop GLP-1s but still need help with disease reversal. Thanks for being here today, Dr. Rice.
Thank you so much for having me. I'm glad to be here.
Appreciate having you here today. All right, let's begin. Please talk about your background. You started your career as an internist and hospitalist, and then you decided to go another route.
I did. So originally, years ago, I didn't actually have a whole lot of aspirations in going into healthcare. My original training was in forensic science, and so and I'll kind of complete this with explaining how I kind of got back to that. But forensic science, in the context of bones and basically putting puzzles together in people that had been missing or just unsolved sort of nefarious deaths essentially. And so my whole career for 3+ years was really in the law enforcement sector, trying to put puzzles back together for bodies that had been recovered. And
Oh,
essentially,
mhm.
I was trying to give people that were no longer with us a voice on what happened to them. And so, after 3+ years of doing that, there's a lot of morbidity and sadness to that. And so, I
Boy.
decided I had two choices to go into the FBI or go into healthcare. And I turned down the latter, went into the former. So, I went into healthcare and ultimately didn't know what I wanted to do. Went into internal medicine and went out once I finished internal medicine, worked as a hospitalist, and then I tried to build a patient practice on the side from my hospital patients. And ultimately, after about 2 years of doing that, I was not happy with the direction of where healthcare was going for people that were in desperate need of it. And so ultimately, I pulled myself out of the hospital, opened up an outpatient clinic, and realized very quickly if I don't learn about nutrition and food and how that actually interplays with disease and getting people healthy, then I was going to be very, very unhappy. And so there was an inflection point with my own health, but also my professional career at that time. And I took a leap of faith and ultimately went into the world of what is now functional medicine, which is truly giving someone the why behind the what. Why do they have whatever diagnosis they've been giving? It's been the best thing I ever did. And so what I like to say is I started off in forensic science working on honestly dead people. And then now I'm working with live people, but I'm essentially giving them back answers to some of the most difficult puzzles they're trying to solve health wise. And so in a way, I've come around full circle. But I'm helping people that can laugh with me, cry with me, look at me, and it just could not be more fulfilling and more rewarding. So that's essentially the story there.
Wow, what an interesting trajectory. Whew.
Yeah.
For patients who were on GLP-1 medications but stopped treatment for whatever reason, what are the key considerations to help maintain their progress?
Yeah, so GLP-1s obviously are very prevalent right now, very popular. My assumption is your audience is familiar with what they do or what they're about, but essentially they are signaling agents that you give someone to send a signal to the brain to help with cravings, potentially satiety and the feeling of being full. But ultimately, the downstream hope is that you lose weight. Um, and there are lots of people that are on these, in my opinion, for the right reasons. Some people are probably on them, maybe not for the right reasons, but let's just talk about the people that come off of them,
Right.
since you asked about that. So, people that either abruptly stop them for financial reasons, stop them because of side effects, or just get to their goal and stop them. No matter what, if you come off a GLP-1, you still need to have the basic principles of how to understand what your body needs nutritionally, how to eat, how to potentially rotate what you eat. But I think probably the most important piece for any of those pathways, abrupt cessation, side effects, or just getting to your goal and coming off, is you have to understand the importance of protein consumption. If you do not meet your protein goals or you are not focusing supremely on protein intake, you are setting yourself up to gain the weight back fairly rapidly. Protein is critical because it induces satiety. It induces the feeling of feeling full. So it has kind of a twofold, you know, role in that it helps you build muscle. It helps you retain lean mass, which then feeds into your metabolism so you can hopefully keep fat off the body. But it also helps you feel full. So you don't grab the sugars or the carbohydrates that ultimately lead to the vicious cycle of glycemic response, insulin spiking, which is what's gotten into this whole problem in the first place, is how people gain weight.
What alternative therapies or lifestyle strategies do you recommend to support ongoing lab value improvement, weight loss, and disease management for those who have stopped the GLPs for whatever reason?
Yeah, yeah, good question. So I think it's important to, if you've come off a GLP-1 and you want to continue to monitor progress in health, but also, the weight loss category, I think bare minimum, you should be looking at a metabolic profile, so kidney function, liver function, but even further than that, I'm a huge fan of fasting insulin. So I truly believe that every human should know what their insulin number is. Um, Diabetes itself begins in the pancreas. It begins with an insulin response that ultimately becomes resistant to the insulin that's secreted from the pancreas. And ultimately, if that insulin stays too high, that's how people develop diabetes. They don't just develop diabetes. It happens through the insulin spike and what's happening at that beta cell level. Beta cells are the cells in the pancreas that secrete insulin. And so as insulin is secreted, it just, hopefully someone is balanced with that and sensitive to it and not resistant to it. But upwards of 30 to 40% of the human populace, I believe, is insulin resistant. So it's a big, big, big problem. So in my opinion, fasting insulin is a massively important test as you start to watch your weight loss journey, on and off of a GLP-1. So from there to the metabolic panel, I think hormones have an interplay here too. As women and men age, things happen to their hormones. And I think done appropriately, certain hormone replacement or certain hormone testing can help you with your weight distribution. So as we age, it's just a medical certainty that a lot of us just gain more fluffiness. We just gain more adipose or fat. We're less firm. And I haven't met a patient yet, a woman or a man, who wants to be fluffy. They all want to be firm. And part of that is not just insulin, but it's also what our hormones are doing. So I think following your hormones, your metabolic profile, and your insulin is a fantastic start to keeping you on the right trajectory.
And what about lifestyle strategies?
Yeah. So on that category and that side of things, so I am not the type of physician that feels like the one diet works for everybody, essentially exclusively. Just like I'm a big believer in muscle confusion, as you train your muscles, you want to confuse your muscles in a way so that they can actually break down and build up better than they were before. I believe the same thing with palate confusion. So if you can confuse your palate in a way, although the common denominator is making sure that you're constantly consuming nutrient dense whole foods, right? We want to really, really, really avoid, it doesn't matter if you're a GLP-1 or not. We want to really, really avoid processed, sort of adulterated foods. We need foods that are basically unadulterated and, quite frankly, don't have much of an ingredient list on them. So whether that's lean meat, lean fish, vegetables, you name it. Some people categorize that as, paleo, carnivore, low carb. I mean, there's all these sort of diets out there, but I would say that keeping a nutrient dense platform, which is high nutrient load with very little sugar or very little processed foods, in addition to, I have nothing wrong with meat or red meat. I think it's fantastic as long as it's properly sourced and nutrient dense. I think it's totally fine. So as long as the consumer or the person can focus on their protein goals, which I'm here to tell you are not, You need more protein than you possibly. As we age, we need more than you think, and people are not getting near enough. So between the protein they need, uh, the the other micro stuff. So vegetables are important, yes, but the other part to this is water. If you are not hydrating appropriately, which I would also do a leap, we're an underhydrated nation. So if you could hydrate more and focus on more protein, those two very simple things, half your body weight in ounces a day of water. And then if you can hit your protein goals change relative to your goals on what muscle you want to retain. So I can't give you a definitive number there, but it really does matter on what the goals of the patient are and how do they exercise, can they exercise, do they want to build muscle, do they not. But meeting those protein expectations and the hydration expectations are the most important thing. How you mix in the other things, from intermittent fasting to grains to carbohydrates, typically in the vegetable form, that really depends on the person. There's no really magic, wand across the board, but protein and hydration are critical, GLP-1 or not.
So this is a good segue. So you've talked about therapeutic wellness, and you've also said that you put food first in virtually all of your medical recommendations. Can you expand on both of these ideas for listeners?
Sure can. So therapeutic wellness is not just it's not just doing one thing that you think is wellness. It's not just doing, Pilates and yoga and something that's categorized as wellness. It is truly taking an active role in developing your own wellness path. So wellness being defined as the absence of disease or a state of being well. So how do you do that? So you have to surround yourself with what I call resilient sort of behaviors. That's getting regular objective testing. In my opinion, I'm a physician, so I'm going to talk like one. I think everyone should be getting minimum once or twice a year a full set of comprehensive blood work to see where things are. I would even go a step further and say sometimes you need to do some saliva testing. In my world, I do a lot of microbiome testing. Like you said from the outset, I'm a functional medicine doc, and you can't repair an immune system if you don't know what the immune system's doing. And the immune system, 70 to 80% of it is the gut. And so I think therapeutic wellness is objectifying data, objectifying where you stand. What does your immune system look like? What do your micronutrients look like? What's your vitamin D look like? What's your omega 3s look like? What do all of these nutrients, are you deficient in them? Are you sufficient in them? It's doing an objective picture. And then ultimately, it's just repleting some of these deficiencies. That is therapeutic wellness. It's the same thing with hormones, right? So if you look at hormone levels and where you are or where you aren't, there's certain levels that optimize your health platform that help to mitigate the risk of disease. And so I think following that data and objectifying it on at least an annual basis is what everybody should be doing for their own health, which keeps them away from sort of, hopefully the need for prescriptions or pharmacologic agents and more doctor visits. Putting food first in every recommendation. I've been saying that for years. I would actually expand upon that. That is a true statement, but I would say it's also lifestyle recommendations. I don't think we live in a world where we can just eat well and hope to be well. Eating well is part of it, which goes back to that whole nutrient dense discussion category, protein goals, water, all of this. But lifestyle isn't just food. Lifestyle is how you sleep. Lifestyle is how you exercise. Do you exercise? I'm a big believer clinically in the power of heat therapy, i.e., sauna therapy. I think exercise, a good menu plan or a good dietary platform with high protein, high hydration, good carbohydrate consumption from vegetables, in addition to heat therapy regularly with sauna, creates resilient behaviors that absolutely helps people avoid some of these lifestyle acquired conditions, which could be things like high blood pressure, high cholesterol, blood sugar issues, weight issues, the very things that drive people to choose a GLP-1 or not, basically.
Hmm. For patients abruptly discontinuing GLP-1 medication, are there any specific transition plans or protocols you follow to prevent rapid weight regain or other adverse effects?
Yeah. So you asked specifically if there's anything I do or my clinics do. And so I'll answer that question directly as to how we do it.
Mhm.
I'll
Yes.
also preface that with how we do it doesn't mean that's the right way. It's the way we do it, and it's the way we see the best outcome. So I'll just kind of give you that caveat.
Okay.
So the first thing is if someone's going to go on a weight loss program with or without a GLP-1, we do not even allow, I don't even allow that to happen unless we have looked at what their microbiome is doing. Are they digesting food? Are they breaking down proteins, carbohydrates, and fats? Is their pancreas working? Is their gallbladder working? Do they have an overgrowth, an undergrowth, a parasite, a pathogen? What is happening at the immune system level? Because I'm here to tell you, people that go on weight loss programs, specifically with GLP-1s, that do not get their gut function in order always do worse. Always. Either they don't notice any weight loss, it doesn't work for them, they think this just doesn't work, or they get terrible side effects, or they actually lose weight, but they become very malnourished. They like what the scale says, but they've lost all this muscle and they feel terrible. Those are the people that when you pull them off of GLP-1s, their weight comes back like that. So in my medical opinion, you can't pull someone off. You can't someone can't safely go onto a GLP-1 or come off of a GLP-1 unless they've earned it. And you have to earn it through looking at someone's immune system, fixing or at least repairing their immune system to the point where they are ready to be on a GLP-1. In my opinion, there too many people are put on GLP-1s that are not even screened appropriately. They're not ready for them yet because they don't know the power of food. They don't even know how to eat appropriately and how to read ingredient labels. Because what I've seen with my own eyes is that when people come off of GLP-1s, if they had bad habits going into them and they keep the same bad habits coming out of them, then they clearly are going to gain the weight and gain the weight fairly rapidly. And so I think from my perspective as a root cause sort of physician on the functional medicine side, I just don't like to use a compound that restricts eating if the person doesn't know how to eat food in the first place, if that makes sense.
It makes perfect sense. And thank you so much for making that point. What role does regular follow-up and monitoring play in ensuring long-term success?
Yeah, so that role is critical. When when a person commits to being on some form of maintenance or weight loss program with or without a GLP-1, if you don't commit to routine follow-up to objectify you, so whether that's measurements, blood pressure, body composition analysis, you've got to somehow objectify you. People like to see numbers. They like to see what's my muscle mass, what's my fat mass, what's my water weight, what's my bone density, how much of my weight is actually made up of my bone. So there's very easy ways of doing this. I think those are very important objectives in addition to sort of the blood work that I talked about earlier. I think at minimum, and this is not a cost prohibitive thing. I think just like you invest in oil changes for your car, just like you invest in getting new clothes because you like new clothes, just because it's the same thing. You're investing in your own body. You really should be doing these maintenance things annually, literally just to see what the last year has done for you. And the real hope is that you have a provider, a prescriber, physician, or just somebody with a medical license to help navigate your journey in a way that's safe for you, but also sustainable, right? Nobody wants quick this or quick that and then right back to their old selves. People want sustainable patterns. The way you could create sustainable success in the weight loss category is for sure building lean mass, building muscle safely, because the more you build, the better your metabolism is. The better your metabolism is, if you cheat, you have a cheat dinner, a cheat meal, a cheat weekend, those cheats don't lead to fat gain anymore. Those cheats literally just melt right off of you. But a lot of people are stuck in this rut where they eat once or twice a week really well, and then they cheat the other days. And so it's this flip flop. And that's not a sustainable model. You're going to continue to store fat and you're going to continue to gain weight. And so it has to be something in which you are committed to building lean mass, so that when the time comes that you just can't eat perfectly all the time, that your body doesn't turn against you. And that truly is I think what we are doing day in and day out, certainly with the patients that I treat. So to your point, follow up is critical. Without follow up, there's really no point in even committing in the first place. You've got to commit to this over the long haul.
So that about sums up weight loss. Does this also work for improving lab values?
Oh, absolutely, yeah. So it all runs hand in hand. So let's keep this as simple as we can. So when you have fat on your body, if you remove fat and you look at what's inside of fat, fat is literally full of just inflammatory particles. It's full of all of the inflammatory sort of constituents that basically lead to inflammation on the blood work and inflammatory markers going up. Fat is full of cholesterol. Fat is full of LDL. Fat is full of blood sugar. Fat is full of insulin. So it's its own sort of independent functioning organ. When you remove that organ through exercise, maybe a GLP-1, some of the principles we talked about on the eating side, when you start removing that and you replace it with lean, dense mass, there's zero chance your objective blood parameters will not improve. So you will see your lipid profile, your cholesterol levels start to come down. You will see your blood sugars, fasting blood sugars, start to come down. You'll see your insulin start to come down. The really cool thing, fatty liver disease is like exponentially taking off in this country. And fatty liver disease is something that traditionally we've said, well, we hope it doesn't get worse, but really reversing it or getting out of it is not really possible. Nothing could be further from the truth. If you remove all of this inflammatory insult within the human body, the fatty liver disease will absolutely go away. The liver is an amazing organ. It will regenerate itself as you start to remove the fat deposits in it. And so, again, you do that through the focus of not just fat reduction, but it's increasing the lean dense mass so that your basal metabolic rate and your metabolism can be functioning appropriately so that you can continue to keep the fat off. So, without a doubt, the labs will absolutely improve. And for years, you'll laugh, for years, I've made this statement: labs don't lie, but people do. So, if someone comes in and they tell me and they swear to me they're not doing this or this or this, and we get the labs, it's truly the great equalizer. It will tell you whether this patient is telling you the truth or not. And so yes, the lab values absolutely improve.
So, what advice would you give healthcare providers looking to implement a therapeutic wellness approach alongside of or in place of GLP-1 therapies?
Yeah, great question. And thank you for asking. So the biggest thing is, if you have someone watching this that is a physician, an NP, a PA, an RN, and they're like, man, I'd love to be able to do some of this stuff. You have to understand that what I'm discussing, I didn't get here overnight. I was exactly like that person. And I just thought to myself, I need to learn. I haven't been taught this. This is not a type of medicine that I've been taught in medical school or residency. So they have to seek out organizations that will comprehensively and holistically train them on concepts that are rooted in science and biochemistry, but will start to help them understand some of the more complicated clinical challenges we see in medicine on a day-to-day basis. So you have to seek out, whether that's continuing education or literally like the things that I did. I just sort of went to various organizations to help teach me, whether that was IFM, which is the Institute for Functional Medicine, A4M, which is an anti-aging academy. Biote is a hormone replacement company that's now moved into the therapeutic wellness sector that's actually getting off into functional medicine. Has helped me tremendously as well. There's a network of these organizations that really fed me the information that I needed to at least understand it. But then I had to bring it back to my practice and figure out how to implement it. So all I would say is these organizations are busting at the seams with people that are joining them. They're not going away. And this person listening to this needs to, I would start virtually. I would do virtual courses and classes, and maybe or maybe not do a certification here or there. Certifications don't matter as much. It's more about just acquiring the knowledge and then applying it to your practice. But if IFM, A4M, Biote, if any of these places can do a virtual experience, so you don't have to do a lot of like traveling and staying and rearranging and all this stuff, then I would take advantage of it. Otherwise, you just got to go where you feel you can trust the most. But there are a lot of really good organizations out there that are committed to the world of therapeutic wellness and truly longevity, helping someone's health span, right? Created not just live longer. I want to live long, but I don't want to. If I feel bad, I don't want to live long. I want to feel great, and then at the end, I want to have like a week, and then I'm gone. The chapter's closed, the book is over, and that's okay with me. But I don't want to feel terrible for 20 years and say I live long. You know what I mean? And I
Right.
think probably people watching this are probably saying, yeah, that's me too. So,
Final question, Dr. Rice. How can clinicians better educate and empower patients, especially those from underserved communities, about alternatives to GLP-1 medications?
yeah. Also a really good question. You've got some great ones today. So, I think there you have to empower people to be the best they can be despite whatever circumstances they faced. You have to keep it simple for them. Anyone, anyone without a gym membership or anything can do basic movements every day that will lead to their body getting rid of fat. It's called zone 2 training. Anyone can do it. You don't need a piece of machinery. You don't need anything. You don't need a membership. Anyone can do zone 2 training. Zone 2 training is what loses the most fat on a human body. So that's number one. Number two, those same people can focus on protein, water, stop drinking sugary drinks, sugars and sodas and things like that. Everything, the unfortunate reality is that processed foods are some of the more affordable foods. And that is not, in my opinion, that is very backwards. If people can stick to a very, what I would say, cave woman, caveman sort of diet, eat what you can kill or you can find on the ground. If you have to shop and read an ingredient label for it, that may not be the best thing. So, vegetables, fish, meat, zone 2 training, lots of water, and protein, focusing on protein. Anyone, no matter their bank account, no matter their access, no matter where they live, it does not matter. Anyone can focus on that because it doesn't cost a dime other than to get the vegetables and to find, the protein and whatever. But even that, it's not as cost prohibitive as you might think. GLP-1s can be very cost prohibitive unless you're a diabetic. So GLP-1s are not an option for everybody, and that's okay. They don't need to have a GLP-1. You can follow these basic principles. GLP-1s just help those same people get there a little bit faster, but that's okay. They can still not have to invest their money in that and invest it, as I said, I think, in high quality food, and focus and have them all look up zone 2. Zone 2 is simple. It's keeping a heart rate between about 70 to 80% of their max. There's a whole formula out there. It's 250 minus their age, and that comes up with a number. If they can stay in zone 2 30 minutes a day, 5 days a week, they are going to lose fat every single time. That's the best way to lose fat. It isn't HIIT training. It isn't all this like high intensity stuff. It is zone 2 training. That's how you lose fat.
Hmm. Um, any advice for vegetarians?
Vegetarians, certainly nothing wrong with vegetarians. It's just protein. It's how can we get with plant-based protein? I will tell you, I'm a big consumer of plant-based protein. The problem with, depending on the individual, the problem with plant-based protein is the solubility of the fiber and can you digest it? Some people that do plant-based protein, like shakes, pea and rice-based protein, things like that, they get bloated, they get gassy, they just don't feel comfortable. So the reason, that's a whole nother discussion, but the reason that happens, they need to have their gut analyzed, truly. And so what you have to do in those cases, which can get a little out there, but is you have to do another, you have to basically objectify your gut. You have to see how you're digesting food. This can be fixed, but you have to do a microbiome analysis. You have to do a stool analysis to know where are the problems. It could be a bacterial overgrowth problem is usually what we see. Bacteria from the colon creep up in the small bowel, and it causes horrible, uncomfortable bloating. And that can be fixed, but you don't know you have it until you test for it. And so it's not that it's impossible. It is more limited and it's harder because there's no animal being consumed for the protein purposes. But you just have to be a little closer or a little more in tune with your gut function. And you just may have to be buddies with a functional medicine provider who can do this type of testing so that you know what you're dealing with when you eat plant-based protein.
Dr. Sarah Ballantyne, she says, I might be mispronouncing her name, Dr. Sarah Ballantyne. She said that legumes are anti-nutrient. I don't know if you're familiar with that. And that's why a lot of vegetarians get that bloating and stuff like that because
Yeah. Yeah,
they
so legumes are notorious. Yeah, legumes are notorious for doing that. It's a controversial subject with legumes and the fiber they bring, but I would tell you that uh, there's two schools of thought on legumes and whether they're helpful or not. But I will tell you the one certainty is it is so patient specific. Some people do just beautifully with legumes and they have stellar microbiome gut function. Others do terribly. So again, instead of trying to guess, it is important to test. Very important.
don't guess, test. I like
Yeah,
that.
don't guess, test.
Dr. Cory Rice, thank you so much for your time today. I really appreciate talking to you about this.
You're very welcome. Thanks for having me on. This was so much fun.